Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Hernia. So hernia is nothing but a protrusion of the protrusion, and this is of the viscous part of the part of the viscous through the wall of the containing the cavity, through the wall of its containing cavity. And what is the classification? The classification is there is a type 1, 2, 3, A, B, C and then 4. So what is this? Is as per the NYHUS. So here type 1 means it is indirect hernia, that is a normal internal ring. Then comes the indirect hernia with an enlarged. So 2 is where there is an enlarged internal ring. Then comes 3A. So 3A means it's a direct hernia, it's a direct hernia. Then comes the presence of 3B. So what is 3B? 3B means there's an indirect hernia. So 3A means a direct hernia, 3B means an indirect hernia. So it is large enough to encroach upon the posterior inguinal. So posterior inguinal wall, and it includes the sliding as well as the scrotal hernia and the pantaloon hernia. So all this comes under the 3B. Now 3C is where you have the femoral hernia, and then 4 is where there is a recurrent hernia. So subtypes, it includes 4, A, B, C and D. So A is direct, B is indirect. So B is indirect. Then comes the D, which is the combined hernia. Then we move on to the Gilbert classification. As per the Gilbert classification, it goes up to 7. So 1 stands for the indirect small hernia. Then comes 2. 2 is for the indirect medium hernia, and 3 is large hernia. The 4 is the direct hernia involving the entire floor. So 4 and floor are rhymes. So the floor involves the direct hernia involving the floor. The 5th one is where there is a direct hernia with the diverticula. Now looking at the 6th one, there's a combined hernia. It is a combined hernia, and this includes a pantaloon. So there is a pantaloon, there is a saddleback, as well as the dual hernia and the Romberg hernia. Next is the 7th one. The 7th one is nothing but the femoral hernia. Now let's look at the RF, that is the risk factors. These are the factors that are causing the abdominal wall muscle weakness. So abdominal wall muscle weakness is seen. So they include there is a patent process vaginalis. So what are the factors causing the abdominal wall weakness? It is the patent process vaginalis, PPV, then the patent canal of NUC, patent canal of NUCK. This is in females, and then the connective tissue. The connective tissue disorders, as well as that is nothing but the hellodrhub syndrome. Next is the prune belly syndrome, and the ectopia vesicae, then the lower abdominal incision, as well as the defective collagen synthesis, smoking, as well as the use of steroids, the steroid intake. To learn and grow daily like this, please do subscribe.